important physical therapists with lots of experience in FMS who have been a great support for us and are always willing to help. Alan Lilik and Jurei Barnik. That every time we visit their clinics, we have full brains but also full stomach. So be aware of this. And also on the aesthetic side, we have our, okay, this is the picture he sent to me, our super clinical trainer, Juan and Daria. Daria is many times sitting quietly, but she has so much practical knowledge, it's amazing, and we are always learning from her. So what is being done from Ischia Medical? We are working on the promotional material that you will have new soon. We're organizing a photo shooting that I would like to have your ideas and necessities. Working on the trainings, communication, the network, and now we're starting to create a pelvic floor guide so there is a better understanding also for the aesthetic sector of the chair and how to use it and apply it correctly. Also, we know the clinical reasoning in physical therapy, we really need the evidence, and the health sector, we really demand and need scientific evidence. We are now going to start a study with Dr. Oriol Porta. He specialized in gynecology and obstetrics, master in surgery, well, he's many things actually. He's the head of obstetrics and gynecology service at Hospital Universitari Mutua Terrassa in Barcelona. And he's also the president of the Catalan Society of Obstetrics and Gynecology. The title will be the following: The Effects of Extracorporeal Pelvic Floor Magnetic Stimulation on Levator Hiatal Dimensions. It will be a randomized, prospective and controlled trial. So what does this mean? We will recruit patients after giving birth, 6 to 12 months. They will receive Tesla chair treatments, and then we will measure the Levator Hiatal Dimensions, which is the opening of the vagina. So we will be able to measure it with an objective and get objective results. And also over pelvic floor measurements of what is actually happening on the muscle tissue. I think this study is going to be very exciting and we will share with you the results. So why invest in FMS? I said treat the active tissue, but I think it's not just about the muscle, what we saw. We have very important effects on the nerve, neuromodulation effect, and also on the smooth muscle and many other structures. So it's not just about contracting the muscle, but about all the structures implementing and working together. It offers a versatility to the users. You can offer FMS to a very wide population to treat different tissues, and also in different stages of the injury. So you don't just use it in acute or chronic, but it is a tool that you're able to use through the whole phases. It is easy to learn, and it's very safe. And of course, we're seeing some patient satisfaction. It was quite funny, I was visiting in Dubai with Fadi. We went into a hospital, and we had to have this procedure to get into the hospital. And the woman in the office said, "Oh, you're the guys with the red chair." And she was so happy because she was receiving the treatments for her. And also no professional presence required. I think with Dr. Tranya was a very nice example how having the knowledge, knowing the effects of FMS, you can create the business model with especially with the chair. So why FMS from Iskra? No other system offers the characteristics that you can treat multiple musculoskeletal disorders and pelvic floor disorders having just one platform. And also having the 4 channels device will have the physical therapist will have the chance to upgrade treatments buying the chair when maybe they see the business of the pelvic floor or adding applicators. So special mention to the chair. We're really seeing a trend of specialized pelvic floor units opening in hospitals, clinics incorporating pelvic health professionals or services, and more professionals specializing in this area. So even if there's a lack of knowledge about pelvic floor disorders, there is still a taboo topic. They're more looking for solutions, but not also women, but also men. So I hope after all these lectures, and even from before, this is clear. Incontinence is not normal, and we can increase the quality of life of these patients. So first of all, the patient has to be aware, and then you can find different solutions. But one of the limitations, especially when there's a cultural limitation, is undressing. Many patients won't want to undress. And also what we're seeing, there is a lack of specialization. Physical therapists, of course, they are growing, they are developing, but still the pelvic floor knowledge hasn't reached them. But they have the knowledge, the anatomy, physiology. So if we teach them how to use FMS, they can also address the pelvic floor muscles. Because there is a very important relation of the pelvic floor with other musculoskeletal disorders. FMS chair is not just about incontinence and pelvic floor therapists. Low back pain is the leading cause of disability in 160 countries. It affects 568 million people globally. So I think it's very important to offer a conservative, painless tool for these therapists. Many patients come in this state. You ask them to undress, they can't even walk. So how can I ask my patient to lay down on a table bed? So the chair is being very nice and very useful for the therapist, but also for the patients. Especially focus on the elderly population. The first reason why they get into elderly residences is because of incontinence. And on the other hand, of course, as Dr. Trania was showing us with the rectum. So it is very important to offer a global approach and also include the core structures and treat the body as a whole and not just in a local way. So having 4 channels, the 3 different applicators, and well, you got the news already, offers a different concept of treatment. Special mention, Dr. Trania, where is it? I think it's a very example of how when you gather you have the clinical knowledge, you gather the knowledge from FMS, you can create a successful business model. So what's new? You saw it around. You have the new trolley, I think a bit more fresh design, designed by an industrial engineer, and the new arm that many of you have been asking for, especially someone from Costa Rica. It allows the therapist, it's easier to use because from one place you can adapt the whole position. So it's user-friendly, and I would like you to play around with it and give us the feedback. I was going to do a presentation about the feet, but Alan went first. How many of you have had problems with feet or know people who have had problems with feet? They are complex structures, more than 100 different structures working together to enable the functionality. They are one of our body areas with most receptors that will carry the information to the brain. So all of this together with other mechanisms will ensure the correct function. They are used for weight transmission and support. They allow us to be active. Posture, they have many receptors that will be used to see the posture and also for other injuries. Balance and stability, ambulation, and they're many times a health indicator. Our ancestors and traditional medicine have really studied deep into them, but now on a more evidence-based clinical side, we study a lot the feet and also the gait analysis for many musculoskeletal disorders and injuries. So what problems can occur in the feet? A decreased sensitivity due to aging, neurological disorders. 1 out of 10 persons will develop plantar fasciopathy. 8% of all running injuries, but it's very common in general population. When I had these patients, actually they were quite troubled. They keep seeking professionals, they go to podologists, they go everywhere, they go to very different physical therapists. So it's quite a long-term injury. And patients with foot pain show greater levels of depression, stress, anxiety, and kinesiophobia, which is being scared to move or use that part of the body. They experience limitations in both mobility and health-related injuries. Also, chronic plantar heel pain is a big problem. And in old people, it can lead to especially very bad consequences, which are falls. We had some physical therapists telling us about their experience with FMS, and one phrase that really stuck to me was, the equipment should adapt to our necessities and not us adapt to it. So Alan did the introduction, but we have the new pelvic floor, feet applicator, sorry. It has achieved the European patent registration. You will be able to adapt it to both FMS Team, FMS Care, and also the Tesla former for the aesthetics. So you will get all the benefits of magnetic stimulation for different musculoskeletal disorders. You will have a workshop with Anand that he will go further into this, but it's quite a very easy procedure. This is us trying the feet applicator. And I would like to share with us the sensations, okay, also to try it and give it a try and explore. FMS application worldwide. We have a Hungarian football player with a muscle sprain, bilateral treatment. Bulgaria University Hospital, treating low back pain and then the shoulder pain. University Hospital in Alexandrovska, Sofia. Physiolution in Costa Rica, and Achilles tendinopathy applied bilaterally, and also in a fracture in the finger. And this would be a functional application after an ACL rupture, after surgery. Here they're resisting the movement or the extension. At the same time, they're activating the quadriceps muscle. So FMS, in one platform, many different possibilities and treatment combinations. And to finish, I would like to say thank you to all our partners and the Iskra family. I missed some of you in the pictures, special mention to Ivanka. Thank you for all. It's very nice to be surrounded by good professionals, but especially with good people.